My name is Cindy Ballor, and I'm the clinical coordinator for the ultrasound program and also one of the instructors. As you were walking in, you've seen the hot dog buns and the Play-Doh and the knives, and that's what my students see the very first day. So that sort of sparks their interest, and with ultrasound, this is the foundation. And I'm going to talk about scanning planes and scan orientation. It's the foundation of all ultrasound. It's going to affect the rest of your career, so you really need to get these basics. So ultrasound is an imaging technique used to visualize soft tissue structures of the body by recording the returning reflection of ultrasonic waves directly into the body. So we're helping aid the physician in the diagnosis of a patient. So I'm going to talk a little bit about image orientation. So I want you to take your hot dog bun, and this is your patient, so please be careful with it. And I would like you to draw a face on one end of the hot dog bun. And we like happy patients. Okay, so we're going to learn the different orientation. So we all know the midline of the body is directly in the middle of your hot dog. So if I can borrow your marker for a second. So here's my patient. So this is the midline of the patient, directly in the middle. And where would the right side be of the patient? This side, okay? And that would be right lateral. So lateral means to the side. And then we have left lateral. And then when we talk about towards the head of the patient, any ideas what orientation that would be? Superior. Yay, we got a healthcare. and towards the feet of the patient would be inferior. Okay? Then towards the front of the patient is anterior, and towards the back of the patient is posterior. Okay? So those are important image orientations that we need to know so that we can learn the scan planes. So this is showing, again, our patient anterior, posterior, superior, inferior, right and left lateral. Okay, then we use transducers in ultrasound, and this is what a transducer looks like. And this is what emits the sound waves out. There's a notch on the transducer right here. And so this is how we always scan in two planes, and it's transverse and sagittal plane. So if the notch is towards the sonographer or towards the left side of the patient, it is transverse. If the notch is going towards the patient's head, we're in the sagittal plane. Okay, so now your hand is going to be the transducer, and the coffee filter, if you want to lift that up. These are the sound waves that are coming out of your transducer. Okay? So the notch is going to be your thumb. Okay? So you want to turn, you're going to place the patient over here to your right because our machine is to the left. So when the notch is towards you, you're in what plane? Transverse. Now turn the notch towards the patient's head, and you are in sagittal. Okay, so now I want you to take your Play-Doh and make a long tubular structure, and that's going to be the aorta. Don't put any aneurysms in there, just make it nice and smooth. And then you're going to surgically open up your hot dog bun and place the aorta in there. Okay, so now if you actually look at your aorta in the patient and you put your transducer sagittal again, so open up your person so that the hot dog so that you can see how the aorta looks, and place your transducer sagittally. So now you see how the aorta is going to look on the ultrasound image. It's going to be long and tubular. Now take it and turn your transducer transverse. And then I'd like you to close your patient up and take the knife and actually cut the bun in half. And then if you look at it, how does the aorta look? Circular, round. And that's how most things look in the transverse cut on ultrasound. They're round.